322 new cases since yesterday. I'm saddened to have to report that there have been now 228 deaths due to this global pandemic in Victoria. That's an additional 19 fatalities since yesterday. Just for the purposes of clarity, there is an increase of 18 on the overall number of deaths. One death that was reported yesterday was removed from the tally due to duplication. They report very quickly. They do their level best, but from time to time we will need to adjust those numbers. That's why the tally won't quite reconcile. Of those 19 Victorians who have passed away, one male in his 50s, one female in her 60s, two males in their 70s, one male and six females in their 80s, and one male and seven females in their 90s. 14 of those 19 deaths are linked to aged care outbreaks. On behalf of all Victorians, we send our best wishes, our love and support, our condolences and sympathies to the families of those 19 Victorians. This will be an incredibly difficult time for them, and I hope knowing that all Victorians are with you is a comfort, some small comfort at a very difficult time. There are 640 Victorians in hospital. 47 of those are in intensive care, and 31 of those 47 are on a ventilator. A total of 1,820,598 tests have been processed since the beginning of the year, and we received 19,213 results since yesterday. There are 2,863 cases in aggregate with an unknown source. That's an increase of 105 since yesterday's report, so another 105 of those mystery cases, which are in many respects our greatest challenge. There are 1,065 healthcare workers who are active cases, so an increase on yesterday, but around that 1,000 number, which is where we've been for a few days now. There are 1,756 active cases in aged care settings, and the total active case number is 7,869. That, I think, deals with, and I should just say, the metro versus regional split, or the stage 4 versus stage 3 split in terms of active cases. My latest advice is that regional LGAs under stage 3 are still around 500 cases. So that is relatively stable, which is very important given our objective there to keep them low and drive them down even further. Again, can I just offer my thanks and praise to all of those Victorians who are following the rules, doing the right thing. It's very noticeable, both anecdotally, just by travelling in and back to where I live in the middle southeastern suburbs. There's just a fraction of the traffic on the road. A lot of the data confirms that as well. But it is really important that we all stay the course on this. It is a wicked enemy. It'll do everything it can to wear you down, and that's when it absolutely flourishes. When we let our guard down, when we are not, for instance, as signed up to these rules as we need to be. That's why I'm so grateful to those who are seeing this through and are making sure that in all the choices that they make, they're doing everything they can, not to contribute to the spread of the virus, but indeed limiting movement, limiting case numbers, and delivering us the objective that we're all focused on. Just before I ask Jenny to speak to a number of changes, as I indicated yesterday, we'd get you an update on some changes around call to test. So where you can't get out of home or where it's difficult to get to a testing site, we have a number of arrangements that we've got in place, and we're taking those to another level. Jenny can speak to that in a moment. I just wanted to draw your attention to a couple of things we're doing. Firstly, I'm going to show you a couple of ads which I think give you a sense of how dynamic and changing our comm strategy is. This is about trying to tell a story to as many Victorians as possible that this virus does not in any way discriminate between people based on age, based on their otherwise healthy status. So many people who have become positive and had very bad experiences were otherwise healthy and were younger, as well as The second of the two that I think we're going to show you, firstly Sarah and Sam, who are a younger couple with a couple of young boys. They're both midwives at the Royal Women's Hospital. They can tell their story. June, who is an older woman, she describes this growing phenomenon where both here and abroad we're seeing more and more evidence that this is not like the common cold. Even for those who get past it, it can have and does have for many people lingering chronic condition type impacts on people's quality of life. So in addition to these advertisements, which will be run on every conceivable platform, there's also, I can inform you that we've shot a number of ads where nurses, they in fact have shot these ads themselves at our request, who are speaking to multicultural communities in their own language. And it's about sending that message in its clearest sense from a healthcare worker who is the last line of defence out to those for whom English proficiency may be an issue, sending that message of follow the rules, do the right thing, make the job of our health heroes just a little bit easier than it would otherwise be. This is a really important step forward. We've changed many times to try and refine the message, to target the message, and we will continue to do that. But I would just say, certainly from my sense of things at the moment, is that people, a larger percentage, a larger proportion of the Victorian community are doing the right thing than was the case a couple of weeks ago. And I think that's something that we should all be proud of. This strategy is difficult, it's heartbreaking, it's very challenging, but it's the only one that will drive down movement across Victoria and therefore drive down case numbers, and that's what we have to be focused on. I know there'll be questions about whether the relatively low number today marks any point of significance. Just in advance of that, I understand where those questions come from, but I think we've all got to be very careful not to be getting ahead of ourselves. We have one day's data. It's always better to be lower than it was the previous day, but it is only one day's data, and the stage 4 changes, many of which only came into effect midnight last night, a number of others which came into effect midnight Wednesday last week. The oldest of these being the curfew that had been in place for 1 week yesterday, as of 8 p.m. yesterday. So it is still very early for us to be trying to measure the impacts of stage 4, but we're certainly seeing perhaps some greater stability that is a result of the cumulative impact of stage 3. And I think yesterday or the day before we shared with you what our experts tell us would have been the case, many tens of thousands of cases if we had not gone to stage 3 and masks and the other settings we put in place. So that has achieved a lot. It just hasn't achieved as much as we need it to. It's brought some stability to the numbers, but we've got to drive them down so that we can reopen.